Okay, so I started recording.
Yeah. Hello, everyone. Welcome. It is my honor and privilege to welcome you all to the official launch of the Learning App Management Practices for Safer Roads. I'm Ahmet Aydemir, the director of CIFAL Istanbul and a faculty member at Bahçeşehir University. At CIFAL Istanbul, it is an honor for us to co-host the event with the United Nations Institute for Training and Research and with AB InBev. We're honored with the participation of UNITAR's Board of Trustees member, Dr. Daisy Kustra, and InBev Chief of Corporate Affairs, Mr. Can Bulat. Welcome, Dr. Kustra and Mr. Bulat. Thank you for joining us on this special important occasion. I also want to sincerely thank AB InBev's Global Director of Corporate Affairs, Ms. Caterina Garcia, as well as the lead of UNITAR's Road Safety Global Training Initiative, Ms. Estella Merlo, for being here with us and for your hard work these past months in developing the learning tool we are presenting today. I would also like to finally extend my greetings and thanks to Mr. Akshay Gupta and to Mr. Victor Chetty for presenting today how the management practices for Safer Roads Toolkit has been successfully implemented in cities in India and in South Africa. Before proceeding further, I would like to mention that if you have any questions that you would like to ask our presenters, you can ask all of your questions during the event in the link that I will now share with everyone. I have shared it through the chat option. You can find the link through Mentimeter, and you can ask any question you want through the Mentimeter, and at the end, we will try to go over them. Now, I would like to once again, thank all the participants, all the speakers for joining. And for the opening remarks of the presentation, I would like to give the word to Dr. Daisy Kustra, UNITAR Board of Trustees member and President of the World Family Organization. Dr. Kustra.
Thank you very much. Good morning, good afternoon, good night to everybody. Our colleagues from CIFAL, from UNITAR, and also all participants. It's my special privilege on behalf of the United Nations Institute for Training and Research to welcome you to this special event to launch our newly developed learning app on management practice for road safety, for safer roads. I am honored to inaugurate this event together with Mr. John Blood, AB InBev, Chief of Corporate Affairs. Thank you, John, and thanks for your team, in special Mrs. Catalina Garcia, for the wonderful way they are having worked together with the UNITAR team to deliver this launching tool that aims to serve as a contribution to make our roads safer. Thank you also to the director of CIFAL Istanbul, Dr. Ahmet Aydemir, for your support in hosting this important dialogue on practical interventions to improve road safety. We welcome the government officials, engineers, planners, and practitioners, and road safety professionals who are joining us today, not only to learn about this learning tool, but also to commemorate the Workday of Remembrance of Road Traffic Victims. In 2005, the United Nations member states declared the third Sunday of November each year as the World Day for remember the many millions who have been killed and injured in the world's roads, as well as their families. Acknowledge the crucial work of the emergency crews, policy and medical professionals, and promote evidence-based actions to prevent and eventually stop further road traffic deaths and injuries. I invite everyone here to not only to remember those who died, but also to support those who survived, and most importantly, to take action to save lives on the world's roads. All of us have a role to play in this urgent endeavor. The high road death toll and crash rates are unacceptable. Our mission at UNITAR is to build capacity, change mindset, and bring about visible change, especially at the national and subnational level. In pursuing these goals, we train public policy officials, civil society, and aim to especially impact those who take decisions and those who make our cities and roads safer. It's not an easy task, but it's not impossible. It is through collaboration with stakeholders from all sectors, academic institutions, governments at all levels, the private sector, the media, the international community, and society as a whole, that we will be able to achieve road safety related targets and to support the implementation of innovative actions to prevent road traffic fatalities and injuries. The management practice for Safe Roads Learning's APP that we present today is a collaboration between UNITAR and AB InBev with the active engagement and commitment from different governments around the world, such as Brazil, China, Dominican Republic, India, Mexico, and South Africa. The APP features examples and practical solutions implemented and tested in cities in São Paulo, Brazil, in Shanghai, China, Santo Domingo, Dominican Republic, Gurgaon in India, Zacatecas in Mexico, and KwaZulu-Natal in South Africa. We are honored to have representatives from India, South Africa, and Dominican Republic who will share about a practical management methodology on how this has been implemented in their cities to identify hazardous roads location and risk factors causing road traffic crashes, as well as to design corrective measures to minimize those risks and prevent injuries and fatalities. It is our hope that this learning IPP serves as a substantive contribution to advance our shared goal to make cities safe, resilient, and sustainable. The Agenda 2030 reminds us of the urgency to provide access to safe, affordable, accessible, and sustainable transport systems for all, improving road safety with special attention to the needs of those in vulnerable situations, like women, children, persons with disabilities, and older persons. This is the SDG 11.2. As a committed road safety stakeholders and partners, let's continue to take bold steps to support the implementation of initiatives that help our cities to meet their challenges and achieve our shared goals. And let's further collaborate to bring new learning and best practice to the next decade of action, accelerating this next decade action for road safety. Thank you very much for your attention.
I would like to thank Dr. Kustra for her enlightening and nice words. You are correct that if any action is going to be taken in the next decade of action, it will be through inclusion, and also it will be through collaboration between different partners and sectors. Now, next, I would like to give the word to Mr. John Blood, the Chief of Legal and Corporate Affairs in AB and InBev. Mr. Blood.
Thank you. And thank you, Dr. Kustra, for that impactful introduction. I'm honored to join you and my fellow panelists, Mr. Gupta, Ms. Rodriguez, and Mr. Chetty, to inaugurate and announce the launch of this learning app in partnership with UNITAR. and this will help advance our road safety efforts globally. As we near November 15th, the World Day of Remembrance for road traffic victims, and pay our respects to all victims, peoples impacted, and their families, our shared purpose to save lives on the world's road is even more relevant today, and it remains a priority. We know that every crash and fatality that's happened on the world's roads has been avoidable to some extent. Road safety issues range from road infrastructure, and others are behavioral, including speeding, drinking and driving, and distracted driving. We at AB InBev believe that we must play a role to make systematic improvements in road safety and to promote smart drinking. Large vehicle fleets in cities and the countryside around the world work to transport our beers every day. In many countries, we're one of the top users of roads and streets. We have a vested interest and a responsibility to ensure our roads are safe for our drivers and colleagues, our consumers, and the communities in which we belong. We believe when you drive, you should never drink. And that means we support targeted legislation and enforcement measures that have been shown to reduce impaired driving. We're convinced that no one can do this alone. The power of partnerships is critical. Just as the causes of road crashes are multifaceted, so must be the solutions, requiring all sectors of society, government, civil society, business, and multilateral organizations. The partnership with Unitar has delivered a significant contribution in the global effort to curb road safety crashes, an issue we care deeply about. Today, we're launching the Road Safety Learning App in collaboration with Unitar, and this furthers our shared commitment to achieving the ambitious goals set forth by the United Nations Sustainable Development Goals number 3 and number 17, focusing on halving the total amount of road fatalities by the year 2030 and promoting general health and well-being. We developed an evidence-based methodology and demonstrated effective results. This collaboration with Unitar contributes to improving road safety by harnessing the power of data and technology to unleash new solutions. It's a very exciting program, and it's just great to see when technology can be used to amplify the works that we have around the world. And this road safety methodology is the foundation of the management practices for the Safer Roads Toolkit that we've now made accessible from any smartphone with the launch of this learning app today. Over the past few years, we have been able to see the tangible results of the toolkit in places like Brazil, India, and the Dominican Republic. As mentioned, we know safe, effective road safety transport systems are essential for the communities where we live. This is critical now more than ever in the context of COVID-19, with many countries reopening their economies and people getting back on the roads. But unfortunately, there's still a lot of work to do. Road safety statistics are staggering. The WHO estimates that there are 1.35 million road traffic fatalities every year. No one can solve this complex issue alone. Public and private partnerships are essential. We all need to be part of the solution. Working together, we can do more, better and faster to save lives. Our distinguished panelists here today will kindly expand upon the success and key learnings seen in their communities throughout the world. None of this would have been doable without great partners at the United Nations Institute for Training and Research, with whom we've been working since 2018. Our collaboration with Unitar enabled us to jointly turn this methodology into a free and practical toolkit that any government can adopt. What was an asset only available on a computer is now at fingertips on everyone's cell phone, and we can create significant change in the world's roads. I hope today's discussions and sharing of our collective experience will bring tangible results that save more lives in our local communities. I thank you all for participating today and your commitment to helping making this goal a reality. And of course, don't forget to download and share the app. It's a pleasure to be here, and I really can't wait to learn as well from our panelists today. Thank you.
Thank you, Mr. Blood, for your informative participation. As you have mentioned, again, the importance of collaboration, public-private partnership, and also that this is a personal responsibility for drivers, but also the government's responsibility to put legislations. Now, before moving forward, both our speakers have mentioned remembrance for the road traffic victims. So I would like to invite everyone for a minute of silence in commemoration of the World Day of Remembrance for road traffic victims. I would like to thank everyone for showing their respects. Now, we would like to present you with a video for the application for the Safer Roads Learning. I would like to ask Ms. Angela to present the video, please. I would like to thank Angela for showing the video. I think there was a slight problem with the sound, but they can still view the video on the website, which we will share the link shortly. Before continuing, I would like to mention again that if you have any questions for our participants, you can ask them through the Mentimeter. I will share the link once again for your convenience. Now, it is important to know about the app, but also it's important to see the management practices and applications for the app that we're talking about. So I would now like to give the word to Mr. Akshay Gupta, Senior Manager of Public Policy and Regulatory Advocacy AB in BEV India, for his presentation, Multi-Stakeholder Action Plan, Road Safety Remedial Measures for Gurgaon City Network, India. Mr. Gupta.
Thank you so much, Ahmed. That was a wonderful introduction of myself. Thank you so much, Dr. Kustra. Thank you so much, John, Estria, Pamela, Angela. Thank you so much for inviting me to present India case study. It's really an honor and privilege to be a part of this panel. So I'll just project my screen. Ahmed, is my screen visible?
Yes, we can see the screen.
Perfect. So before I jump on to our India case study, just a brief background about the smartphone usage, because we are talking about an app launch. So right now, we have a population of approximately 1.35 billion, and the smartphone penetration is approximately 30%. I'm talking about the year 2019, but by 2023, the smartphone penetration would be close to 35%. So there's immense potential for this app, and as a road safety project, as a road safety app which would be launched in India. I mean, this can be distributed to all the trucking society and also the cab drivers, and everyone could be benefited with this app. So I would like you guys to just focus on the last 2 points of this slide, which is the most important point. So in India, we see that there are approximately 1.5 lakh, 1.5 lakh road accidents, which is approximately 150,000 people. They die because of road safety accident, and that puts a burden of approximately 3% of the country's GDP, which translates to approximately 8.2 billion. Now, there are a lot of metro cities in India, but the reason behind choosing Gurgaon were very specific. First of all, a brief background about where Gurgaon is located. So Gurgaon is located. So it's located in the northern part of India, in the state of Haryana, and it's a major satellite city of our capital, which is New Delhi. And also, if you look at the background of Gurgaon, the government is completely aligned to road safety approaches. In fact, the government had rolled out a program which is called the Haryana Vision Zero program, which was aligned to what we were thinking of implementing. Even since the model which we have implemented in Gurgaon is a PPP model, which is a public-private partnership. And Gurgaon is also the hub of all the top corporates. So that also allowed us to easily connect with all the corporates for our road safety work which we were doing. This is a quick snapshot of what's exactly happening in Gurgaon. So in 2019, there were a total of approximately 1150 accidents, out of which close to 90 were fatalities. The maximum percentage of accidents, the profile was of motorcyclist and the pedestrian, and this has of course been widely covered in media as well. And I'll tell you guys that from where I've taken this data, this is also a part of what we are doing in Gurgaon. So once we were able to sort out that we would be implementing a road safety pilot in Gurgaon, we saw that there are a couple of improvement opportunities, which included the implementation of road safety management routine, user awareness, stricter legislation and penalties, road signs, and also road infrastructural design and changes, and also crash information flow. And I'll of course explain what are we doing at each of these levels. So finally, after deciding that we would be implementing our city pilot in Gurgaon, this is what we do. This is rather what we did. We made a consortium, which included people from the government, which included people from the NGO, which included engineering experts, top corporates, and also advocacy and outreach. And other than that, all the top training institutes as well. So if you can see to the right of the slide, this is our working group members, which include, of course, AB and BEV, top companies such as PepsiCo, DLF Foundation, Unitar, Trax, which is a very renowned NGO which works for road safety in India, and also CSIR, which is which provides us with all the who are the engineering experts in this case. And what the first thing which we did here was we roped in CSIR, of course, and we did a comprehensive study in Gurgaon, and we were able to figure out 14 black spots. After we were able to figure out 14 black spots, and of course, what can be the road safety remedial measures in 14 black spots, we had to approach the government for necessary approvals to work on those black spots. Now then came the part about funding. Now this funding was not just ABI who was sponsoring it, or maybe any other corporate. It was about a comprehensive work, which together as corporates we did. Now, these were our field of actions. First was data analysis. So I'll of course talk about data analysis of how we are actually getting all these data. So first we used to analyze, okay, fine, if this is a black spot, what are the number of accidents? We used to do a trend analysis, what were the number of accidents in 2017, 2018, 2019, and so on and so forth. Then what can be the action plan? So our engineering expert team from CSIR, once they did a thorough study, they came up with a comprehensive road safety remedial measures, which were then presented to the government for final approval, and finally the work on those black spots. Next was, of course, awareness. We understand that road safety remedial measures is one part of it, but then there also needs to be a behavioral change between all the road users, and that also we focused on. Education, and of course the UNITAR application which we launched last year was a great example of how we can educate all the vulnerable road users. Then was, of course, R&D, and of course we also had a lot of campaigns wherein we showed what can a road user do if he or she encounters someone who's involved in a crash. This was our summary of activations for 2018. So first, there was an outreach and formation of a larger working group, which I just showed in my previous slide. Then what we did was, in order to make this consortium or this road safety work which we're doing, we actually ended up signing an MOU, which is a memorandum of understanding with directly the Transport Department of Haryana. So this was done because our goal of reducing the number of road accidents, and also the Haryana government's vision of reducing the number of road fatalities, were completely aligned. And then it was all about getting all the working group members together for meetings, aligning on the objectives and what role each and every member would play. Then it was about we did as I mentioned previously, we did a road safety study of all the top black spots, of which CSIR was our partner, and they also kind of suggested these are the kind of remedial measures. Then the data dashboard, which I'll of course speak in my next slides. Then there was a ABI UNITA Road Safety High Level Conference, which was organized, and of course all the working group members participated in that. Then there was, as I mentioned, 14 accident road black spots. The field work was done, the study was prepared, and then finally there was road safety remedial measures as one of the black spot, which is mentioned here, which is the Huda City Center. These are some of the on-ground activations which we did. And of course, as I had mentioned, it's not only about the road safety remedial work. We need to educate the road users as well. So these are some of the images. In fact, for the Road Safety Week, which we did in Gurgaon, we were able to connect with approximately 175,000 road users. And yes, this was our social media campaign, which we did in partnership with one of the leading social website of India. So this was about a survey which was floated to all the people who were living in the Gurgaon or the Delhi NCR region to understand key behavioral aspects. So if you can see, approximately 30% of the users jumped a traffic light because of the reason that there was an absence of cop or they were running late. And what we did was we invited the top cop of Gurgaon, and we submitted all the results to him to take necessary actions. This was an event which we had organized last year, and the main idea or the main aspect of this event was to launch two of our very critical items. First was, of course, the data dashboard, which was launched by the Honorable Minister of Road Safety and Transport. And second was the e-learning module, which was developed by UNITA, that was launched by Dr. Shashi Tharoor, who is, of course, related to UN as well. Now, this is the main thing. This is the core of our project, because we would like to understand that if we are doing any intervention, what is the impact on that? So, in India, so if there is an accident, it may or may not necessarily be reported to the police. That is the first aspect. So what happens usually is whenever there is an accident and it is reported to the police, it is enrolled in their registers as an FIR, which is the first information report. Now, usually what happens is all these FIRs are in regional language, and they have informations which are very haphazard. So what we did was we connected with the Gurgaon Police Department. We took all the FIRs from them, starting from 2017 till 2020, and we have translated them into meaningful information. For example, if you can see here, this is just a snapshot, and this is the link of the dashboard. You can slice and dice the data, and you can understand what are the top black spots of the city in month-wise, year-wise. What is the age profile? What is the profile of the victims? What is the age of the victims? You can slice and dice the data. You can slice the data by months. You can slice the data by weeks. And this is actually what will help us to understand that if we are actually implementing road safety remedial measures at a certain black spots, at a certain black spot, what is the impact? Say, for example, after 10 months, 12 months. Of course, that has to be combined with a lot of other factors as well. And this was launched by, this we had created, and it was launched by the Honorable Minister of Road Safety and Transport. And this is about this is one of the study which was conducted by CSIR. And if you look at the interventions, these interventions are not very big transformational interventions. There are two reasons for it. Because what we have seen is that these small interventions, such as signboards, lane marking, pedestrian crossing, directional markings, I mean, if these are implemented properly, these small interventions can actually bring about a bigger change. Instead of of course, I mean, if you're doing a proper infrastructural change, that's a different aspect, because that will also cost, that also comes with a lot of capex. But in this case, these small interventions, if a lot of these are done, these have the potential to kind of reduce the number of road fatalities and accidents. And this is a snapshot of one of the black spots which we had conducted, these studies. And these are the steps which we usually take for our black spot correction. So first is the study which is conducted by a research partner, which is the CRRI. Then, of course, the vendor onboarding. And the third and the critical element here is the government approvals. Because in this case, government, since we have signed an MOU with the Haryana Transport Department, and both our objectives are completely aligned, we get necessary approvals to work with other corporates as well. Then is, the road safety experts, they come and all the road safety remedial work is done there. And finally, of course, evaluation is done. And that is usually done after, after 12 to 18 months of time to measure the impact. And this is one of the interventions. This is an example of the implementation which we did at one of the black spot. So if you can look at the pictures, so it's not very big infrastructural changes. It's just that with proper signboards, roadside markings, cat eye markers, and everything is present. And of course, we have seen positive results here as well. And of course, these are the initiatives which we are planning for 2020. So in the next as we speak, the work has already started at one of the black spot, which is the Hero Honda Chowk. And we plan to implement road safety remedial measures in 2 black spots by the end of this year. Then the data dashboard, which is like the heart or the core of this entire initiative, we need to maintain that for 2020, because that will help us to understand how are we faring. Next is, of course, engaging all the working groups together, and then of course working as a team. And lastly, we plan to organize a webinar in the second week of December to it would be a commemoration event of what we have done in the year and what are our plans for 2020. So that's all from my side. Thank you so much.
Thank you, Mr. Gupta, for the detailed presentation of how we can actually make our roads safer in the regions that we're in. It is also very nice to see that you don't always need very big structural changes. Even with some small changes, with personal changes, we can actually help save lives. And I think we can all agree that we need safer roads for safer lives. I would like to thank you again for the great presentation. And now I would like to give the word to Mr. Victor Victor Chetty, the Director of Road Traffic Inspectorate in Department of Transport from the province of KwaZulu-Natal, South Africa, for his presentation of the city pilot project implemented in KwaZulu-Natal, South Africa. Mr. Chetty, and also Ms. Angela for the presentation. Mr. Chetty, the floor is yours.
Thank you very much, Amit, Mr. Blood, Angela, Catalina, Dr. Kustra, Ajay, my colleague, Pamela, and Lisa, my colleagues from South Africa. Now, firstly, it is an honor for me to present the best practices in the province of KwaZulu-Natal to this meeting. I'll be taking you through the aspects of the Alcohol Evidential Center and the electronic breath alcohol testing systems. Angela, could we go to the next slide? Basically, I'd like to take you through to the project background on AEC and EBAT, the current status, the legal limits, and our results. Earlier on, you mentioned that it's about partnerships, and what we believe in the province of KwaZulu-Natal in South Africa, that road safety is a collective responsibility. And whilst we talk about collective responsibility, it is a social obligation as well. So the background in the province of KwaZulu-Natal started in partnership with the South African breweries, now AB InBev, who had this long-standing relationship with the Department of Transport, where we needed to deal with road safety initiatives as a department, but in collaboration with the corporate sector. And this is where South African breweries and now AB InBev got involved. South African breweries started the project in the early 2000s, where we established 4 alcohol evidential centers within the province. And that was within the road traffic inspectorate, the directorate that I'm responsible for traffic policing in the province. And we started the centers in Umdloti, Ladysmith, Potchefstroom. That is my hometown. This is where I'm presenting my talk today. And Pietermaritzburg, where I work. That's the capital city of the province. We started the project in 2000, and there were vast successes in terms of using the Drager machine, an electronic device that we took breath samples from motorists that were over the legal limit or presumed to be over the legal limit. But what happened in the country in November 2011, we had a high court ruling in the Western Cape where the machine was contested, the Drager machine that was used, and we had to discontinue the use of the machine. And it made it very difficult because we had to go back to the old ways of dealing with motorists in terms of drawing blood, using registered nurses, district surgeons, and these created problems as well. But nonetheless, we continued. And what we did is additional requirements had to be prescribed in terms of the AECs, the evidential testing equipment, the Drager, and training of operators. To this end, all AECs had to comply with the prevailing standards prior to any evidential alcohol testing, EBAT, that were launched in the province and in the country. We'll go to the next slide. I just want to show you a picture of the EBAT, the new improved one now out of the 2011 court case that we had. This is a system that we are using now until the 26th of March this year when we declared the COVID. This is a technology that is recognized. It's an alternate testing method that enables us for immediate results that are acceptable in court. there are benefits to this technology, and we subscribe to what our president, the Honorable Cyril Ramaphosa, mentioned in his inaugural speech when he was inaugurated as the president of the country, that we need to look at technology and embracing the fourth industrial revolution. And the eBat technology is what we look at. The AEC is a place used to test a suspected drunk driver and confirm his breath of alcohol content. Breath testing can be done at a mobile center or a designated building. So the eBat can be used in mobile. You can get a modified bus or minibus and utilize that throughout the areas of your policing. So the beauty part of this technology is it takes 12 minutes to get a breath sample from a motorist to determine his legal limit and then prosecute and deal with him in terms of the prescripts of laws in the country. Results are printed out immediately. We get 5 copies that are made available. This is very helpful to avoid any corruption. In the field that we come from, there's corruption everywhere. And that's our problem as well. When we talk about fatalities and crashes in the world, we need to look at the issue of corruption as well. So these copies are attached to dockets and presented to the court of law, and you have them as file copies. Courts may still be inundated, but the Director of Public Prosecution for each province has to sign off on the use of eBat and AECs. So prosecutors are fully on board to deal with it. What we did in the province of KwaZulu-Natal when we finalized the eBat system, we invited the, in your countries, you would call them the district attorneys. In our country, we call them Director of Public Prosecutions. So he needs to buy into the concept and the technology that you use. So what we believe and we practice is we brought them on board. We had workshops. We took them through the processes of the eBat and the AECs, and we brought his prosecutors that prosecute these cases as well. So they were fully on board. So the results were in the making, and I'll discuss that in the next slides. Our law enforcement officers, all my officers that are deployed in the province, were trained to deal with the eBat as well. So what we have is successful prosecution is possible in 14 days if all is adhered to. So that is from the officer stopping the motorist, identifying his sobriety, dealing with him in terms of the processes, and presenting him to the South African Police Services and then taking him to court. So you can have a case finalized in 14 days using the technology. But with our country and constitution, a suspect is allowed representation in a court of law. So your cases are postponed. Positive results, reduction in fatalities, and that was our main aim and goal as the province of KwaZulu-Natal in partnership with AB InBev and South African breweries, was to reduce fatalities, injuries, and accidents. And we took that, the pilot project, to the city of Maritzburg. We'll go to the next slide. I just got some pictures of what the pilot eBat center is, so we can just skip through that. That's the center. And what we are saying is, going forward now, that AECs and mobile AECs will be the in thing for the province and for the country, and it must be for the globe as well. I just wanted to talk to you on the legal limits. In this country, we have prescripts of law that speaks to motorists when you drive on our roads. No person shall drive a vehicle on a public road while the concentration of alcohol in any specimen of blood taken is not less than 0.05 grams per milliliters. Or in the case of a professional driver, that is somebody, a professional driver is somebody that drives heavy motor vehicles and public transport, like your Ubers, your metered taxis, your buses, not less than 0.02 grams per 100 milliliters. In a case of breath, while the concentration of alcohol in any specimen of breath exhaled by such person is not less than 0.24 milligrams per 1,000 milliliters, or in a case of a professional driver, not less than 0.10 milligrams per 1,000 milliliters. But what we are doing in the country now, and the National Minister, the Honorable Minister Fikile Mbalula, has prescribed a legislation, and we took it out to comment through the provinces and other stakeholders in terms of bringing our alcohol limit to 0. Now that is what we are aiming for, and I endorse that fully. We'll go to the next slide. The current status, subsequently after several engagements with the Director Public Prosecutor, we received an authority from the Director on the EBAT for testing in Pietermaritzburg, and we launched that in February 2019 as a pilot project. In March 2019, the AEC, that's the traffic section in Pietermaritzburg, was recommissioned with the approval from the Road Traffic Management Corporation. That is our governing body in the country that works with the National Department of Transport, Road Traffic Management Corporation. The alcohol operations at our AEC in Pietermaritzburg have proven to be very successful. As of 18th March 2020, we arrested 1,094 drivers that have been prosecuted by means of using the EBAT, the technology that we use. However, since the declaration of the lockdown in March this year, we had to stop using the EBAT because of the issues on the coronavirus, and we are holding that until we get the go-ahead from national. But I wanted to just allude to the statistics and data on the next slide in terms of the prosecutions that we had in the province. We had preliminary results for the pilot project in Pietermaritzburg. Angela, that's the next slide. The Alcohol Evidential Center in Pietermaritzburg came into operation in April 2019, and our South African breweries, AB InBev and South African breweries invested in the infrastructure of the building, and the evidential breath test alcohol machine was launched in Pietermaritzburg. Since the implementation of this machine, fatalities in the jurisdiction of the AECs have been reduced. Angela, we'll go to the next slide. The same period the previous year of 2019, that was 2018, we recorded 46 fatalities in just the Pietermaritzburg, the city, the N3, the corridor that takes us to Durban. Since the implementation of the AECs, we reduced to 26 fatalities on that road, in that area. This gave us a 44% reduction in road fatalities. And over the period to date, we have arrested 1,544 people for being over the legal limit. 1,094, we used the dragger. They were over the legal limit. And then we had to draw blood out of 450 motorists. That is because it is common practice for motorists when they are caught with their back against the wall, then they develop other chronic illnesses that they cannot breathe into the pipe. So we have to use other methods prescribed by law, and that is to draw blood. This is my last slide. So basically, I did a quick follow-up with the prosecuting authority, and out of the 1,544 arrests made, we finalized 287 cases that were presented to court, and fines totaling amount to 1.2 million that were paid to the state that pleaded guilty in terms of their transgression. So basically, that's the end of my presentation, but I'd like to reinforce the importance of looking at technology, and what we are busy with in the province of KwaZulu-Natal now is to look at having more AECs And I'm researching now, and I'm trying to partner with the state of Victoria in Australia. They are using beautiful technology. They are using the luxury liner buses and converting them into mobile EBAT centers. But with all these said, it goes to the fact that you need the resources, you need the budget, and you need political will, power, and you need officials who are dealing with this to have an appetite to go out and deal with enforcing the law so we can reduce crashes, we can stabilize the province and the country and the globe in terms of having nobody killed on our roads and nobody injured, because it costs states, it costs organizations lots of money. So that is my presentation, and I want to thank everybody for listening in and participating and allowing me to come on board to share the best practices. And I am positive in terms of the results and where we want to go and where we want to take our partnership with AB InBev, SA Brewery, and UNITA as well, in terms of saying, let's put our collective wisdoms together and come up with more strategies and innovations as well to deal with road crashes and fatalities. Thank you very much.
We thank you, Mr. Chetty, for sharing this informative presentation with us. It was solid, concrete proof that innovation and technology can help save lives and protect people. So thank you for sharing that. Before moving on to our next speaker, I would like to ask Ms. Angela Montano to share the video once more, this time with sound.
Significant progress on road safety can be achieved by means of global cooperation, implementation of evidence-based strategies, and engagement with all relevant actors, including the private sector. With the aim of contributing to advance road safety, the United Nations Institute for Training and Research, UNITAR, developed the Management Practices for Safer Roads Toolkit mobile app, which presents a practical management methodology that can be applied in the field of road safety. The app provides in-hand practical solutions, participatory contributions from different stakeholders, including the private sector, and results-based interventions. It highlights projects in which the methodology has been implemented and tested in cities in Brazil, China, Dominican Republic, India, Mexico, and South Africa. It also features a checklist to support users to monitor their progress along the different stages of the Plan, Do, Check, Act Toolkit's methodology. Join us in the quest to reduce road traffic deaths and download the Learning app from Google Play and Apple Store.
Thank you, Angela, for the video. And at the end of the seminar, we'll be sharing the link for the video once again. Now, next speaker is a respected colleague of mine for the expressions of interest to receive technical assistance for implementation of the toolkit. I would like to give the floor to Ms. Estrella Merlo, the lead of the Road Safety Global Training Initiative at the United Nations Institute for Training and Research. Ms. Merlo.
Thank you, Ahmed, and thank you to the rest of our colleagues who have joined today, and of course to AB InBev, our partner in this effort to provide training on road safety. It is quite an honor to share with you today about our initiative and the tools that we have developed, and just recently the Learning app. Our goal at UNITAR and through this partnership is to contribute to the Agenda 2030 for Sustainable Development, and specifically to contribute to advance SDG 3.6, which calls urgently to halve the number of global deaths and injuries from road traffic accidents by 2030. as Dr. Kustra said, is not an easy task, but also it's not an impossible one. And also goal 11.2, improving road safety with a special attention to the needs of those in vulnerable situations, women, children, persons with disabilities, and older persons. We cannot think of sustainable communities if people are dying on the roads. And this goal calls us to have not just sustainable cities, but also safe, resilient, and inclusive cities. And we know it's not an easy task, and it's only through partnerships with the private sector, with academic institutions, with NGOs, with civil society, and all of us as road users that we will be able to achieve that ambitious goal of reducing by half the number of deaths and injuries around the world. And let's just forget for a minute about the number, the statistics. We're talking about people's lives. And today, on this special day as well, in which we remember the many millions who have lost their lives, we are hopeful that with our contributions, we could contribute to prevent and eventually stop those deaths in the world's roads. And today, as we have presented the Learning App on management practices for safer roads, I also want to share our approach going forward at our institute, and together with partners at InBev. We are very most, we encourage all of you who are listening, whether from the private sector, from the government, from academic institutions, to use our online training, our learning app, but also to reach out to UNITAR to join our workshops. We are also providing training, not only face-to-face, but blended training on how to implement and use this management methodology, and also providing technical assistance as in the cases you saw earlier today in South Africa or in India or in other countries. We're also ready and stand ready to provide technical assistance for an initial assessment and the development of an action plan that can be later on implemented by your government wherever you are. So we today invite you not only to download the app to learn about the tools that are available at no cost, thanks to our partners like AB InBev, to you, and to reach out to us as well to submit a letter of expression of interest and to request assistance. We stand ready to provide not only training, but make those tools accessible. They are available in different languages, in Chinese, in English, in Spanish, in Portuguese, and very soon they will be available also in French and in Hindi for you at no cost. So please reach out to us. This is our contact, and we'll be more than happy and ready to assist with training and assistance to implement the management practices for safer roads toolkit. With that, Amit, I thank you for this time and thank everyone for joining us today.
Thank you, Estrella. I would like to thank you for your lead in this project, for your work, and also for reminding us that even though during the pandemic we have become accustomed to talking about people losing their lives as numbers, we still need to remember that each life is precious and we have work to do until we have 0 lives lost to traffic accidents due to road unsafety. Now, I would now like to move on to the questions. I think there are 2 questions for you, Estrella. You mentioned how people can contribute, but there are questions that says, how is there a formal process for local governments or state governments to apply the road safety practices and the toolkit? And also how can the private sector contribute to implementing the toolkit in a city?
Thank you, and wonderful questions. Thank you, Ahmed. Yes, we are open to any request from local governments and national governments for the implementation of the toolkit. And simply, please reach out to us. Our contact, and maybe I can share it again. Our contact is just via email, roadsafety@unitar.org. We'll be more than happy to respond to any request In fact, we have already received several requests from local governments, and in early 2021, we're also starting to work together with several governments on the initial assessment and how to implement this toolkit. So please reach out to us. We'll be delighted to respond, to see and to respond to the request. And on the second question, which is more important, and I would like to invite perhaps Mr. John to also Mr. John Blood to also comment how the private sector can contribute. Well, this is a great example of how the private sector can contribute. This methodology, in fact, was tested, developed, and donated by AB InBev. We have applied this methodology that has been used in private sector settings to the field of road safety and successfully implemented in several cities. So we're talking here about expertise that is valuable for governments and for others around the world to learn also what the private sector can contribute in terms of expertise to advance road safety like we are seeing today. So I will ask please, Mr. Blood, if you would like to comment, but certainly the private sector contribution is essential in our goal to advance road safety.
Thank you, Estrella, and I love the question, and I'll address it in two ways. The first is the why, and then the how, right? The why business should be involved in this is very clear to me, right? And I was really struck by Mr. Chetty when he was talking about in his presentation. It was clear to me when he mentioned that this is where he lives, this is where it impacts him and his family. It was so powerful and so authentic when I heard him speak that way. And what I would challenge the business community as well is to understand that this is also where we live, where our colleagues are, where we have colleagues of ours who work and live. And it's not just the matter that the business community uses the roads for their own trucks to transport their goods, but this is where our colleagues, you know, their parents, their children, their friends, their family, they travel the roads. This is not something that is for someone else. This is truly part of a business issue because this is where we live and we work. So for me, the why is extraordinarily clear. And on the how, it's very important that we take techniques in the business world, such as measurement and evaluation, project management, all the types of things that we use day in and day out, and share those techniques and that expertise with our colleagues in NGOs, in cities and towns, national governments, to make sure that we play our part and fulfill our responsibility as bringing to the table what we can bring. And a lot of this isn't some sort of magical tool. A lot of this is very much the bread and butter of what businesses do. It's about identifying data, unlocking data, making clear about how data should talk to each other, how you can use that data. There was a great example of where, you know, that data was out there, but it was in different languages in different areas in India, and being able to put that data in a way that we can use it so we can draw insights from that data, and with those insights, then have action items to address what the real underlying root causes are, is just critical and a step that business can help provide. So, you know, I'm really excited about the measurement and evaluation and the business management and project management tools that businesses can help with and help their colleagues. But of course, business only provides one, and we need to do it, but we need to do it in a way that learns from our colleagues in government, whether that's national, state, provincial, towns, cities, but also our NGO colleagues as well. And it's only through that combination of the why and the how that we can make real impact together. Because as I really felt in Mr. Chetty's presentation, the importance and the urgency is there because this affects all of us, regardless of what institutional category you might fit in. This is our problem. So that would be my response.
Thank you, Mr. Blood and Estrella, for the responses. Another question was about the multilingual aspect of the app. So will it be available in multi languages? But Ms. Merlo already answered that, I think. And Ms. Merlo, if we want it to be translated to our own local language, is it again the same process we apply through the email that you have provided with us?
Yes, thank you. And Ahmed, here I also invite you as our CIFAL director to also work together so we make it available in languages as well, in any language that you deem appropriate. So with the support of also our CIFAL global network around the world, we'll ensure that this app is available in as many languages as possible. But right now it's in English, it will be available in Spanish as well. And the toolkit is available in 4 languages, 6 very soon, Hindi and French to be added. So we'll make the effort to have it available in as many languages as possible.
Thank you, Ms. Marlo. We also have one more question for Mr. Gupta. Mr. Gupta, you talked about the small interventions in your presentation that actually helped save lives. Now, how do you decide which spots require these small interventions? Do you do a needs analysis, or do you have a process in deciding which spots need these?
Correct. Thank you so much, Ahmed. Very good question. So as John had mentioned, so the entire India Road Safety Initiative is based on data dashboard. So we collect data from the FIR reports, which is there with the police department, and we turn it into meaningful, actionable items. So the first thing which we do is we collect data on a month-wise manner, and then from that, and not only on month-wise manner. So there are approximately 1,065 roads in the city of Gurgaon. So we know that in each road, how many accidents are there. And by that, we are able to figure out which road or which spot is the most critical spot and which needs urgent interventions. And by that, there's a ranking mechanism in which if you open the dashboard and if you see the data for any year, it will show you the top 10 black spots in that region. And that's how we select the black spots and do our road safety remedial measures. So it's to answer your question, Ahmed, it's completely based on data, and there is a lot of data analysis into it.
Thank you, Mr. Gupta, for the answer. We have no more questions now. Oh, okay, sorry. Now we have a new question. So the question is, it's a very valid question for today, obviously. Is the coronavirus affecting in any way road safety nowadays? Who would like to answer that question? Yes, Mr. Chetty, please.
Yes, from a law enforcement perspective, like the technology that I presented, that we were using it and we had to stop. So now we are dealing with national in terms of getting scientific specialists to adjudicate on the EBAT and the devices we're using to indicate and give us direction in terms of will it spread the virus? Because members of public are so paranoid that once Corona came in, we didn't even want to see each other because we didn't understand how we're going to get infected or infect each other. For me, as a law enforcement, my officers are skeptical as well because they are in the front line, and we've been on duty since we've declared COVID in March, and now we're going right until 15th of December. So your officials who are enforcing the law to ensure there's compliance will be pulling back in terms of that and saying, we cannot do A, B, C, and D. So we need to look at mechanisms to say, now, how do we reassure your ground forces, your soldiers on the ground to do their work? That's from my perspective in terms of enforcement, that the COVID-19 has impacted somewhat. Because I'll tell you what, when you looked at certain videos that were circulating globally, you realize that the birds and the bees and the flora and the fauna were coming out and in bloom because we were all in lockdown. My accident statistics in the province of KwaZulu-Natal from March until June, July, dropped tremendously, almost 80 to 95% crashes and fatalities because we didn't have motorists and road users using the network. So there are positives and negatives when it comes to COVID-19. But for me, as an officer of law, I'm feeling a bit claustrophobic, a bit as my hands are tied to my back because my ground forces are reluctant because you've got to deal with trade unions. So those are the issues from a law enforcement perspective. Thank you very much.
Thank
Can
you.
I add as well? Can I just
Yeah,
add to that?
of course, Mr. Vlad.
I'd love to just sort of, I support Mr. Chetty's comments. I thought they're very well stated. In addition, you know, when I think about the impact of COVID, I think it's very important that we continue to make sure, right, that road safety is a top priority for us, right? And don't get me wrong, there are clearly, you know, things we need to address with COVID, and of course they are important. We continue to do that, but I also think it's incumbent upon us, right, to make sure that we continue to work on road safety, that road safety doesn't somehow become less of a priority. This is in fact a time where we can focus in and say, what more can we do now? Because it's something that was here pre-COVID, is here during COVID, is going to be here after COVID, and it continues to be a top priority. I would also say that the impact of COVID goes to one of the fundamental ways that we're trying to get to the goals of zero road fatalities, right? Which is working together. And COVID puts up a lot of obstacles to working together, but it's really incumbent upon all of us to use the technology so we can meet by calls or have webinars like this where we can still come together in the ways that we can, respecting all the social distancing, respecting all the rules and regulations. But it's important that we overcome whatever hurdles there, because only by being together are we going to make progress. And I do have great optimism that we will continue to make progress. So I think that the tools are there for us to continue to make it a top priority, to come together, but it requires us to be agile and adjust. And I'm excited about the willingness of folks to do that because we know how important it is.
Thank you, Mr. Vlad and Mr. Chetty. Now that you mentioned, I think we should really thank the ground workers, the law enforcement workers, who are having a very difficult time actually during COVID because they have to work face-to-face with many people. So let's be thankful for them again, and thank you for the comments. Now, for the closing remarks of the presentation, I would like to give the floor to Ms. Catarina Garcia, the Global Director of Corporate Affairs of AB InBev. Ms. Garcia, the floor is yours.
Thank you, Ahmed. Thank you to all of the panelists and those of you who attended today's discussion. Conversations like this are critical now more than ever as we commemorate the World Day of Remembrance for road traffic victims and seek to tackle the global public health crisis impacting humanity. We are very excited to see different communities and policymakers use our Road Safety Toolkit learning app to execute data-driven and evidence-based road safety interventions, as mentioned, of very important and easy methodology to implement. The knowledge codified in the toolkit will help government officials, road engineers, policymakers, local NGOs, and companies develop plans and mobilize their own efforts to improve the safety of our roads, to build institutional capacity, and ultimately save lives for years to come. Once more, I would like to thank UNITAD for their support in developing this toolkit and learning app with us and other partners these past 2 years. Without your collaboration, this would not have been possible. I am proud of our partnership and our joint support to the United Nations Sustainable Development Goals of reducing road traffic deaths and injuries by 50% by 2030. Before we disconnect today, I would like to end by asking you all to help spread the voice of our app's existence beyond this meeting. You will find it in the chat. There is the link. It's also our duty as road safety experts to create a culture of awareness around our work. Communities and road users need to be aware that there is an issue at hand, and that by raising their voice, working with policy makers, we can bring about change together. This isn't a one-way approach. but one that involves collective efforts between public and private entities, NGOs, drivers, and users of roads themselves. Thank you to all involved. Our work demonstrates the power of bringing people together to make a better world, exactly what the United Nations SDG number 17 of partnerships proposes. While I am extremely proud of the joint efforts between UNITAR and AB InBev, today's announcement is not our final destination. I look forward to continuing our collaboration, building on our successes, and welcoming new partners to help achieve a safer and more sustainable world. Thank you very much.
Thank you, Ms. Garcia, for reminding us again of the importance of partnerships, and that also this is both a personal, a corporate, a social, and an academic responsibility of all of us to help save lives. Now, I would like to end the session by stating that as a person who is joining you from Turkey, a place where almost 20 people die each day due to traffic accidents, it is an honor for me and for BAU and Sifal Istanbul to see the formation of this app. So I would like to thank UNITAR, AB InBev, and everyone who joined their forces globally to present this app. And of course, I will make sure that in Istanbul, in Turkey, we try to spread this app as much as possible to save lives. I would like to thank all the participants, all the speakers for joining us for this informative event. And I would like to mention that this event will be broadcast through YouTube after the event ends, and we will be sending all of the participants the link for the event. Thank you all for joining in, and I would like to wish you a very good, healthy, and safe day, and please keep safe on the roads as well. Thank you.
Thank you.
Thank you.
Thank you, guys. Bye.
Bye.